Good evening and welcome to the Palomar Health District 3 Board of Directors Candidate Forum brought to you by the San Marcos Chamber of Commerce. I'm Chamber CEO Rick Rungaitis. The Chamber is an advocate of business dedicated for the promotion and development of a positive business environment in San Marcos. The Chamber serves as the best resource for its members and the business community to promote a positive business climate, economy, and quality of life in San Marcos. It's also the role of the Chamber to promote the community, and we take this role very seriously, whether it's hosting street fairs or a farmer's market or tonight's candidate forum. Candidates that will be participating in tonight's forum are Laurie Edwards-Tate and Rod Jones. Thank you to the candidates and to all the attendees who are virtually watching tonight. Also to let you know that this forum is being recorded, and we will be able to post on our YouTube channel tomorrow, as well as eventually we will have it on our website. We'll promote it on social media and our newsletter. So if you know someone that wanted to attend today and was not able to watch, it will certainly be available. I want to go over the format for today's candidate forum. Each candidate will have 2 minutes for opening remarks, followed by a series of 3 questions. The candidates will be given a signal by me at the 10-second mark to wrap up their comments. The candidates received these questions on Friday and will have 2 minutes to respond tonight. The Chamber sent out a survey several weeks ago asking for questions. The 3 questions being asked tonight were decided upon by the Chamber's Board of Directors from questions that were submitted. After all the candidates have answered the questions, they will be given 2 minutes for closing remarks. So with that, let's go ahead and begin with opening remarks, and we'll start with Laurie Edwards-Tate.
My name is Laurie Edwards-Tate, and I am Director of the Board of Palomar Healthcare. I wish to begin by first thanking the San Marcos Chamber of Commerce for this opportunity today. Since 2018, I have served our hospital district and you and your families honorably. Serving as Secretary of the Executive Board for 2 years, I was also directly involved, along with board members and executive committee members, helping us get through the very difficult COVID times. I also have served as chair of several committees of Palomar Health. I've participated in ad hoc committees, special closed sessions while maintaining the Brown Act, consistent public meetings, and currently am vice chair of 2 healthcare advisory committees. Moving back in time, the first several years of my early career, I worked in responsible positions at several major hospitals, leading to my role working for a top cardiac surgeon. Through that experience, I had the opportunity to stand shoulder to shoulder with doctors and nurses in the operating room. And I witnessed a mitral valve replacement from beginning to end. It was from that experience that I realized the necessity of highly trained physicians and frontline staff working as an interdependent team. By doing that, patients' lives and outcomes are high, and the need to go back to the operating room for repairs and also problems with bleeding are reduced. Moving forward, I'm also a college teacher and have taught several subjects in business and development.
Thank you, Laurie. I'm sorry, your time's up. Next, we will hear from Rod Jones.
Good afternoon, and thank you for joining this meeting to learn about the candidates running to be your representative for the Palomar Health District Board of Directors. And thanks also to San Marcos Chamber for hosting this event. My name's Rod Jones, and I'm running for Palomar Health District Board because I'm interested in the continuation of the award-winning healthcare that our community is now receiving from Palomar Health. I know that top quality healthcare is not possible without a strong and solid financial organization to support it. Over the years, Palomar Health has grown to become the largest public healthcare district in California and one of 7 largest in the United States. It's a large, integrated business that will become even more complex as it continues to grow and expand health services. A diversified board of directors with members knowledgeable about healthcare and members with deep financial experience is essential. I believe that my 30+ years of experience as a local community bank executive, analyzing and evaluating businesses and advising those business owners, as well as my own personal hands-on business experience, will be beneficial as Palomar continues to provide nationally recognized healthcare to more than 1 million San Diegans it now serves. Thank you.
Thanks, Rod. And now we will have the first question. And this, Rod, you'll answer first. The first question is, what do you see as the most critical needs for local healthcare service? Rod Jones.
Well, the COVID-19 pandemic has redefined the future of healthcare. It's revealed critical priority areas, which include making healthcare accessible, more affordable, and focus on keeping people healthy rather than simply treating them when they are sick. Responding to the unmet health needs of our community is essential for a district hospital. I understand that Palomar Health is a participant in the Hospital Association of San Diego and Imperial County's Community Health Needs Assessment. Based on the most recent findings, the top community health needs in Palomar Health District are cardiovascular disease, type 2 diabetes, mental, behavioral health, and obesity. The Palomar Health Board must ensure that services and initiatives align fully with these known demands. I'm a strong supporter of Palomar constructing a behavioral health hospital to serve North County. With very few beds available for over 1 million residents, Palomar taking a leadership role in adding over 120 beds with a behavioral health focus would be a game changer for North County. I also support Palomar Health engaging in more community health improvement activities like educational programs and collaborative community health initiatives. As a public health district, they should be committed to caring for our communities, both inside and outside the hospital walls. Thank you.
Thanks, Rod. Next, Laurie Edwards-Tate to answer question number 1.
Yes. First, we need to provide optimal access with sensitivity to population health. And population health are social determinants of health, such as healthcare, individual behavior, social environment, and physical environment, which all comes down to outcomes having to do with mortality, as well as health-related difficulties. We're proud to be a Live Well. I am proud to be a Live Well community partner. And I believe that our county of San Diego is moving in that direction in a long way. But we need to do more as a healthcare district to reach outlier populations, underserved populations. And we also need to continue creating innovations in robotics, telehealth, cancer treatment, Alzheimer's disease, and of course, cardiovascular disease and mental and behavioral health. I would also like to see focuses placed on intervention as well as prevention, and moving forward in that direction, integrating that whole concept within social determinants of health. Thank you.
Thanks, Laurie. Now it's time for our second question. And this question is, we are currently seeing a national crisis with regards to fentanyl use and addiction. How should Palomar Health be engaged to combat this crisis? Now, first to answer this question is Laurie Edwards-Tate.
I really spent some time with this because, to be honest with you, the issue of drug addiction is a societal problem. Unfortunately, what happens is people come to hospitals like Palomar Health when things become a crisis for them. So I have to look at it dimensionally. We have federal, we have state, we have local issues, and we all need to work together in order to combat the origins of what creates an addictive society in the first place. Now, the thing that's interesting about fentanyl is it was originally developed for pain relief. And as we know, we've had a tremendous opioid problem as well. And what happens is people walk into the emergency room and they may have certain behaviors. And so when we look at that, it requires highly astute physicians to be able to recognize and diagnose what is an organic problem, what is one created by addiction. Now, with issues such as addiction, we have issues of security within our emergency room, within our hospitals, and we need to look at that. And we also need to look at the potential for creating more detox centers to help people get back to normal behavior. But we also need to work as a community hospital with other groups, other organizations, with the district attorney, the police, and the fire, to realize that what we have is a massive problem that's going to require massive cooperation.
Thanks, Laurie. And now it's Rod Jones, it's your turn to answer that question.
Well, we know that fentanyl use and addiction is not only a national crisis, but San Diego is the epicenter as more fentanyl is being seized in San Diego than at any of the nation's other 300 plus ports of entry. We regularly see in the news reporting on how bad the problem is, but seldom is there a recommendation as to how to address the crisis in a meaningful way. I believe that's primarily because the problem is so complex that it will require multi-sector, multi-pronged, coordinated effort by medical leaders, politicians, law enforcement, educators, public safety experts, and mental health providers. Palomar Health is already responding to crisis and treating addiction and improving that ability with its plans for building a behavioral health hospital to serve North County. Additionally, Palomar is well positioned to become a leader in actually solving the problem by engaging the multi-sector group I mentioned earlier to participate in conversation focused on the coordinated effort needed to permanently solve the fentanyl crisis. Thanks.
Thanks, Rod. Now it's time for our third and final question. And it is, what is the biggest challenge for Palomar Health right now? And what is your plan to meet that challenge? And we'll call on Rod Jones first.
That's an interesting question, particularly because I'm not a current board member and I don't have access to inside information that would enable me to make a knowledgeable evaluation. There is enough public information, however, to allow for reasonable, accurate analysis. I believe, therefore, that the biggest issue facing Palomar Health are financial stability, workforce stability, and maintaining access to quality care and patient safety. My years of experience with financial analysis, as well as publicly published reporting, tell me that the COVID pandemic negatively impacted hospital cash flows because of income-producing procedures that could not be performed. It will take some time for all hospitals, including Palomar, to recover that loss of cash flow. We know that vitally important healthcare workers have been hit hard by the pandemic. They've suffered the financial, family care, and health impacts felt by all of us. But additionally, they have experienced burnout from the extreme pressures of providing care throughout that difficult time. Many felt compelled to leave their jobs, and some left the profession. Developing strategies to replace those workers is essential to continuing to provide quality care.
Thanks, Rod. And now we'll call on Laurie Edwards-Tate to answer the question.
The truth is that the most important thing that any institution, including Palomar Health, can do is survive. The truth is that we have received awards as the world's greatest hospital. The Newsweek is currently listing us as ranking as 162 in the United States. But we've lost district hospitals in California. We've lost hospitals in the districts in California because we cannot continue doing things the same way we've been doing them and meet the critical needs of an ever-changing marketplace. And we're seeing reimbursement changes in how reimbursements come from the state and other places, which are going to have direct impact on the bottom line. We see increases in the aging population, as well as a high growth in developmental disabilities. We are not prepared for what we've known for years as the silver tsunami. And by 2030, we're going to lose approximately 90,000 physicians, and people are not entering medical school at the same rate. We have a horrific staff shortage of healthcare workers across all spectrums, including our own hospital. I believe that decisions have been made which have caused us to lose invaluable physicians and invaluable staff. And I believe that those decisions have been made short-sighted. There are more concerns than just finances, though finance is something that I care deeply about. What we're talking about is meeting a changing dynamic where we can have a lot of physical plant, but we are going to need to be more organic and more flexible to realize that hospital stays are going to be reduced and more surgeries are going to be performed on an outpatient basis. The long-term projection too, when I served in Washington, D.C.'s National Association and attended things and was actually elected to that association in a particular sphere, is that the projection is that we may be performing small surgeries in people's homes in years to come.
Thanks, Laurie.
You're welcome.
Okay, and now it's time to have our closing remarks, and we will start with Laurie Edwards-Tate.
In addition to my work with Palomar Healthcare, I am a CEO of 30 years. I have founded both a nonprofit organization with my own board of directors and currently a majority owner of my own small business, which is 100% woman-owned. We serve hundreds of clients throughout the county, so I'm an employer. Additionally, in addition to what I mentioned about being elected to a national home care association, I've also been elected to a state association, and I currently serve now in the legislation sphere of that organization through the legislative committee, and I review legislation on a state level. I've been experiencing what it means to have an imbalanced government at the state level and how it trickles down and affects absolutely everything we do, including our hospital and our ability to provide effective health care. So recently, I was also appointed to ACHD, that's our District Hospital Association, to the Educational Committee. So I am going to be having impact on districts within our own state. So I believe that when I put all of my various components together, including demonstrated leadership, common sense decision-making, honesty, transparency, a desire for more public engagement, high value for our physicians, high value for our employees, I am running again to be there for this hospital and our district and for you, to help be there to help shape a changing future. Thank you so very much. Please vote for me, Edwards-Tate, for Palomar Health Board 2022.com. Thank you.
Thanks, Laurie. And now, Rod Jones, you have 2 minutes for your closing remarks.
So thanks again for attending this Zoom event and for the thoughtful questions that have given us the opportunity to further explain our philosophies and approaches to serving the community through service as a board member for Palomar Health. As I stated in my opening remarks, Palomar Health is a public supported business that provides healthcare to hundreds of thousands of San Diegans. Outstanding healthcare requires top-notch health professionals supported by a financially strong and vibrant organization. Thanks to the quality team that has been built in the current administration, Palomar Health is positioned to grow and expand services to a growing population while maintaining its national recognized reputation as the world's best hospital. A strong, knowledgeable board of directors who understand healthcare is essential for its continued world-class performance. The financial challenges Palomar will face as it continues to grow and expand services will also require a deep and thorough understanding of financial issues to ensure the continued financial health of the organization. I'm asking for your vote so that I can provide that critical expertise. Thanks.
Thanks, Rod. That concludes our candidate forum for this evening. On behalf of the San Marcos Chamber of Commerce, I want to thank both of our candidates for participating. I'd like to thank for those of you who submitted questions and of course our board of directors who selected the questions, and also for those of you who attended the Zoom event tonight. We appreciate you joining us tonight. So again, thanks to everyone for participating. Have a great rest of your evening. Thank you.